Hi, my name's Keith. I'm a 2 times cancer survivor, prostate cancer. 2004, I was diagnosed and I'm still here.
My name's Tony Briddick, and earlier this year I was diagnosed with an aggressive breast cancer.
My name's Kay Alison Shemarani. When I was 46 years old, I was diagnosed with lobular invasive grade 3 breast cancer. The diagnosis was poor. Following surgery, I declined all chemotherapy, radiotherapy, and drugs. I decided to do my own path, which was a nutritional path, and I'm alive and well today, 7 years on.
My name's Che. I'm a current trainee solicitor working in central London. When I was 17, I developed a stage 1A carcinoma. My right ovary had to be removed in the process, and I'm a current survivor.
My name is Darren Blackwell. At the age of 10 and a half, I was diagnosed with leukemia. 18 months later, I was diagnosed with Langerhans cell sarcoma. Ultimately, I got sent to a hospice with 3 days to live, and a cannabis tincture brought me out of the hospice and kick-started my bone marrow again.
Hi, my name's Jan Clements. I work with Jeff Ditchfield and Bud Buddies. Bud Buddies is a non-profit organisation that helps people access safe medicinal cannabis that's often illegal, and we help people to become educated in their own care, to become self-sufficient in their needs.
Hi, I'm Dr. Aaron Ghosh, and welcome to My Life, My Choice. Today we're here to stand up against cancer. Now, cancer is actually one of the most emotive subjects, but you are more likely to survive it than any other time before. 50% of people will actually survive a cancer diagnosis up to 10 years after receiving that. Here's the video to show you the fight that we're currently all going through.
We have always had villains and tyrants to face, baddies to take down.
We are powerful, and we will win, so stand up with us.
It's payback time.
Payback's a bitch.
So, guys, 1 in 2 of us, according to the latest research, will be diagnosed with cancer. And I think that's the point that we're trying to talk about today is how did we get to the journey of our treatment? So, you've obviously done your own research and you had friends that have done there. You've obviously worked with some incredible people who sound like they've done a lot of research as well as your own journey. You weren't in a conventional therapy point of view because your cancer was so rare. You know, if you're the 50th person ever to have that and no one else in the country, I can imagine that conventional treatment, well, it clearly wasn't working for you. So what did you have to lose? Absolutely nothing. And your testament that it has actually helped. You've done your own research as a medical professional. You've come to that conclusion of how you wanted to treat that compared to what was out there. So actually you're in a unique position of comparing the two professionally. And that's now developed and gone forward. But you guys followed what we would say would be the normal route. We would follow that. How did you get to that point? How did you choose for the surgery?
The doctors basically said, look, we think you've got a cyst, we don't know where it's coming from. You can either let it pop or you can have surgery. But we paid to go private because the NHS waiting times were quite long back then. It was only after I came out of surgery that the doctor said actually it was coming from your ovary and we had to remove your ovary.
But you went all NHS.
Yes.
And it shows how they are moving things forward because cryosurgery sounds like very advanced type of surgery indeed.
Yeah, well.
And how did you get to that choice? Was it because you didn't have any other choices or you led the doctors to?
Well, the oncologist virtually said that it's hormone treatment now to slow it down. And then he said there's this trial at the Clatterbridge, and he was offered me up to see if I wanted to do it, and gratefully accepted because you know there's no brain really. Where was I going to go otherwise? So yeah, I accepted it, and we had the surgery, and it worked.
So how did you guys all decide to come up with natural treatments? You're sitting in the surgery bed, you're literally sitting there having brought these 2 books in, and suddenly thought, do you know what, I'm going to completely go against my belief in doctors or completely go against the belief in surgery and I'm going to do this. What was it that changed for you?
So why I got it, going back, peeling the layers, told me and my ex-husband what I would need to do to rectify the reasons as to why I'd got it. So I was clearly very toxic. I'd had so many vaccines when I worked as cabin crew for BA. I'd had the pill, the morning after pill, IVF, all the toxins, all the makeup, everything that I'd used that was not organic, all the pesticides that were estrogen mimickers, all of the symptoms I'd had, heavy menstrual cycle, pain, migraines, all of these were telling me that I had been estrogen dominant and very toxic. And I was also deficient in lots of vitamins and minerals, which is why I was getting the symptoms I was getting. So the treatment that we found addressed the toxicity and the deficiency.
So you, and I guess many of you may ask this question, why have you got cancer? Why did that happen to you? I mean, Darren was so young.
I remember my mental state in the hospice was horrendous. I either wanted to be completely healthy or dead. There was no in between for me in my life at that point.
So you were ready to die?
So
How old were you then?
I got moved to the hospice 10 days after my 14th birthday.
So you were 14 years old and ready to die?
Yes, yeah. I'd accepted it completely. And
there was no treatment that they could offer you?
No, I like I said, I was in the hospice. I was on my deathbed. No pharmaceuticals. They were literally they were giving me a blood transfusion every now and again so that I didn't just totally deteriorate.
And did your mum tell the hospice she was giving you this tincture?
The nurses in the hospice, initially, they just sort of figure it out.
And Jan, you have to tell me, is there science then that if we can de-stress the body, that the body can heal itself, or is there something in the cannabis itself that can help with cancer?
Cannabis works with the endocannabinoid system. So its job is to maintain homeostasis, to make sure that all the other systems, cardiovascular, digestive, neurological, etc., are working to optimum levels. And so it boosts the immune system, which then aids self-healing. One of the problems that we have in the work that we do is that it's not available to people legally. You know, they can't get a prescription from their doctor. Doctors often are reluctant to even discuss cannabis because they don't know about it. They haven't been educated in their line of work, you know. And so it's very hard for people to access safe information that they can trust. And then it's also very difficult for them to access safe medicinal cannabis that's actually going to help them. So that's where we come in. We help people to do that.
Obviously, we're trying to stand up against cancer. We want to get people really inspired to go with whatever journey that they decide to do, whatever health choice that they decide to make, to say, actually, there's a really good chance that you can beat this. Could you give anyone any words of inspiration?
If it's 1 in 2, you can rest assured that someone very close to you is going to get cancer. So why wait to be diagnosed? We should all be changing our diet now for our children. Lead by example. Start eating a more natural, healthy diet, less meat, all of the foods, the processed foods that make us acidic, the meat. These are all the causes. Acidity, disease does not grow in alkalinity, you know that. So all of your fungal infections will not grow in an alkaline environment, and cancer behaves very much like a fungal. So keep the body alkaline.
So you're saying prevention?
To keep talking.
So if you can say to people, what's the best thing to do, you would say, look at your exercise, look at your diet.
Well, not even exercise. Exercise is only 20%. No amount of exercise is an offset for a poor diet. Today's food becomes tomorrow's cells. And it's as simple as that. And that's pregnant women as well. If you're eating junk, your child's cells are being built on junk. Plug-in air fresheners, it's a huge market. They are so toxic and cancer-causing. Drinking tap water, fluoride, destroys the thyroid gland, pushes out all of your iodine, and your thyroid needs it, breasts need it, women need it. So you should be eating clean foods, plant-based foods, keeping everything to a minimum, resting, clean up your environment. When you do it for your children. People talk about genes, all of the latest hospitals being built. Genes must be expressed. What expresses them is diet and environment.
But it is hard. You know, those choices are hard for people to make. But Darren, as a young man, as it were, when you were that age, and there'll be children watching this as well, what would you say to them in terms of you were at last bit, you were literally told there's nothing else we can do, go to a hospice, make peace with it. What would you tell them?
It's all about your mental state. And you have to have an open mind to everything. There's been times where I've sat in hospital and I've just meditated.
How unhealthy were you prior?
I was very healthy. I was training with an adult rugby team twice a week. I was also going to my own rugby team 3 times a week. I was fitter than most adults that I was training with. I had a 6-pack. But it was my diet. I was eating pizza and I was eating chips. I was a kid. I was eating sweets and stuff, and that's what screwed me over. That's what got me. It was my diet.
And what's your diet like now?
I'm a vegan.
So there we go. We've got 2 people talking about that. So I want to show you this young lady here. Okay, so this lady's called Kerry. She's a former Playboy model who's choosing to treat her brain cancer with illegal cannabis oil. Now, she said she's never been fitter, she's never been healthier. She's a model who owns her own nutrition business, but this time she's refused chemotherapy and wants to use cannabis to treat her cancer. What do we think about that?
I think if the cannabis oil works, then go for it. I think there's there's no harm in trying it, like Tony said. What have you got to lose? You know, it's cancer. It can only help, I guess, or make it worse. So I think it's worth a shot if she believes in it.
What about you, Keith? What do you think?
Much the same. It's her choice, and if it's going to help her mentally as well as physically, then she should go down that route.
Now, does your particular path go with cannabis?
Well, there are many things that will kill cancer. Cannabis oil being one of them, Laetrile is another, choline toxins is another, mistletoe is another. All of these things will kill cancers, and they've been proven time and time again. But the foundation for restoring the immune system is that you address the toxicity and deficiency. But I also think it's great. She's making an informed decision, and I think that's what every single person deserves, is a true and informed decision, and that is what is the foundation of consent. When choosing to do any of these alternative therapies, one always must not lose sight of the end result is that you would like the patient to be alive and well, and hopefully cancer-free. So if their tumour is tracking along bigger, then you can restore the immune system, and every other kind of therapy that you're using, be it cannabis oil, be it all the things I've mentioned, is not regressing the tumour, then you're not going to save the patient. So this is where it's good, where you can marry, and then you get this coming together of both allopathic medicine and what's known as alternative medicine. And if that means to cut out a tumour, or to reduce that tumour size with cytotoxic drugs, chemotherapy, or even insulin-potentiated chemotherapy, a much milder way, and coming along then with the cannabis oil, with nutrition, with any other therapies, then I think that's good. For her personally, I would advise her to put some frankincense and myrrh on the roof of her mouth every 2 hours as well.
So the difficulty when it comes to cannabis oil is actually the legality.
Yeah.
Now, you work with Jeff, who's actually risked going to prison over his thoughts and beliefs in supplying people with cannabis oil.
Yeah.
Now, I want to hear from Jeff, and then I want us to have a discussion on whether we feel that's right, or is it about time things need to change?
Parents are asking me for help with their terminally or seriously ill child, and they're telling me in messages that they see me as their last chance to save their child's life. The only thing that would stop me helping the mother of a dying child, the only thing that would stop me helping her would be my fear of the law. And I feel that any law that there's no victim of, that says that I have to stand by and watch a child die when I know I could help, doesn't deserve respect. It's not a case, as I see it, why do I do it? It's a case of how can I not do it? GPs, general practitioners, they should be able to prescribe cannabis. They should be able to tell a patient of theirs to grow a cannabis plant if that's what the doctor thinks is in their patient's best interest.
Interestingly, he really believes that this should be something that should be available. As you said, the law is changing, so very recently now doctors have been allowed to prescribe medical cannabis, obviously for set conditions, and it's a start. I know it's legal in 27 other countries, so maybe we are a little bit slow. But do you feel time is changing now on cannabis oil?
Yes. For one thing, the cat's out of the bag, you know, the word's out. People in general have heard about the healing properties of cannabis, and there's, you know, quiet outrage about why it's not available. So the pressure is on for things to change. So we've got a long way to go.
I mean, Darren, your story was actually in the media.
Yes. But my doctor, on the other hand, he put his fingers in his ears when I mentioned the word cannabis.
Even though you turned the corner from a hospice?
Yeah, even though there's the book and everything.
Tell me about the book. So what's the book about?
Well, the book is about my treatment from my mum's point of view. So it has loads of treatment photos in it to show how bad I was.
So the title is The Boy in 7 Billion.
Yes, and I would just like to mention that I have tried to get cannabis on prescription and I can't even get it.
Okay.
So exceptional circumstances, I am one of the most exceptional circumstances and I can't even get it because I've tried.
Ooh, so we know how hard it is to get, and it might be changing, but it's going to be slow. It's going to take so long that, Tony, you're still left in the situation, even though it may become legal, where you have to buy this illegally?
Yep, I'll continue to buy it illegally. You know, and a lot of what Kate said in the green room before, you know, with the diet and everything, I truly believe that.
And Kate, do you get challenged by doctors when you talk to them about this?
I do.
Therapy?
I do.
I speak to oncologists, and a lot of my patients who suffer with cancer will say, "Oh, what should I eat? What should I do? Should I, you know, I've heard about this," and the oncologists go, "Oh, it doesn't matter. You can eat what you like."
Now, I was given a document by a trained dietitian of a patient who was in hospital who had esophageal cancer and was losing weight and wasn't well, and they were being advised to eat white bread, cakes, beans to get their weight up, eggs. These are all things that will actually A, make you acidic, and B, make a tumour grow even faster. No drug will cure you, and every drug has side effects. And people are not making a true informed decision to consent because they're not being told the truth.
Genetics obviously plays a big part as well. So we are genetically prone to particular types of cancers in families. So when we talk about breast cancer, there are genetics.
We have weaknesses to that.
We see major celebrities having, you know, major operations to remove, I think it was Angela Jolie, removed both her breasts because of these particular genes. So where does our genes come in?
Well, they have to be expressed. All genes have to be expressed. And what expresses your gene is diet and environment. You can have 3 sisters, the Nolan sisters, that was so sad. 3 sisters, all with a BRCA gene. One eats a diet that's vegan and clean and organic, plant-based. One does it half and half, and the other one eats all fast food, alcohol, smokes, plug-in air fresheners. This one definitely will get cancer. The middle one...
You hate plug-in air fresheners.
They're so toxic.
I'm getting this message. Plug-in air fresheners, like...
But the middle sister, as she ages and her immune system becomes more compromised, she becomes more toxic, the likelihood is that later in life she will develop cancer.
So we're coming back down to prevention. Okay, so we've gone from all the treatments that we've had, obviously some of the miraculous treatments that we've had. But it comes down to lifestyle change, and that's what Kay's, I think, really powerful in describing, is saying, look, if you're going to look at the causes, you need to look at what you've done to your body, because really with genetics you can't change that. Okay, what you can change is how much you express of that. So some people get cancer and, like you said, they hide it away from the world. They don't want to tell people. They don't want anyone to know. It's the shameful thing that they're going to go through. And other people start running marathons, start eating the cleanest they've ever been before, and some even do calendars of their treatment, which I think is just, it's just so empowering.
The day I stop fundraising will be the day I go,
I think this has been such an amazing conversation. I think we've really learned lots, but I think the overall thing that we're getting from this, if I summarise it up, is we need to look after our bodies. We need to be really aware of what's going on with our bodies, pick up our symptoms early. If we can do that, we're going to find far more cancers, and hopefully we can treat more cancers, whichever way we decide to do it. Obviously, there is definitely going to be changes coming up in the law. They may take too long. Miracles do happen. You're continuing to fight, which is just empowering. It's absolutely phenomenal. I'm so proud that you came on. You guys show that conventional treatment does work, whether it be surgery, whether it be forward advances in that type of surgery that happens, as well as hormonal treatment. And Kay, you've been really inspiring to tell people how it is that they can treat themselves ultimately and with what they do. And I don't think anyone can not stand up and listen. So thank everyone here for coming. It's been a really interesting conversation. Now remember, this is your choice, it's your life, and this is probably the most important decision that you're going to have to make. But actually, the odds are in your favour. I'd really love to hear your comments on what everyone here has had to say, so subscribe, get involved in the conversation, and let's be part of this together.